Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty. Tell me what's going on.
So I experience lower back pain, mid back pain, neck pain, and currently I have a very bad headache all day. And then this has been burning for the last 3 days, but it comes and goes for the last 2 years.
Okay.
Yeah.
So how did you hurt yourself?
So the first time I remember it was when I was 16. I was playing badminton, and then I went down to get the birdie, and and then that's it. I could not get back up for a few days, and then afterwards I was fine, and that was the first time. And then maybe I say 7-10 years ago, I start, feel like I get,
The spasm?
yeah, or sometimes it gets pull muscle very easily, and then it just hurts for a few days, and then it just repeats the cycle.
Okay.
And I remember falling on my tailbone multiple times.
Okay.
Yeah.
Did you fracture it?
No, I didn't.
Okay. So how long does back neck pain been going on, persistent now?
Persistently, probably about 5 years ago.
5 years ago. Okay. And what kind of treatment you had for this issue?
So physical therapy, chiropractic, adjustments.
Okay. So how much pain do you feel now from 0 to 10?
Each area is different. So the knee is just burning sensation. That is about 7 to 8.
7 to 8.
Yeah, it's very bad.
Mm-hmm.
The neck,
Mm-hmm.
it's also on and off, and when it's on, also maybe about 6 to 7.
Mm-hmm.
Yeah, and sometimes it's dull pain, then it'll be like 2 to 3 to 4.
Mm-hmm. Do you have constant pain anywhere?
This one has been constant pain.
How much from 0 to 10?
This one would be between 3 to 7.
Okay.
Depends on the days.
So what aggravates your symptoms?
This one is I always feel it worse when I wake up.
In the morning?
Yeah.
Okay.
So yeah.
But it's going throughout the day?
Yes.
It's consistent, okay.
But the pain is more when I first wake up, and then it decreases. This one.
So you feel bend in both legs?
Yes, both legs.
Mm-hmm.
And this one started 2 years ago.
Okay. What do you want to focus on, like back, neck, or like we can do this area or this area? What do you want to do? Work on?
Right now.
No cheating, no cheating.
Right now.
Don't listen to the island. Just to whatever is more uncomfortable. Do you have headache now?
I have headache now.
So we need to work on that.
Probably.
Okay, how much from 0 to 10?
Right now it's probably 5.
5 and headache. Is it constant?
Yeah, it was
For
constant
how long been going
from
on?
this morning until now. So
Okay, where do you feel it?
8 o'clock, huh?
Where do you feel it?
Right now it's right here.
And you feel that headache and neck pain and neck back pain. Okay.
And lower back.
Okay. So is there any motion can we use it to see your if that can aggravate your symptoms?
Aggravate. For my headache or my neck?
Both. Let's move your neck left and right.
So,
That's tight. Flex, extend. Okay.
Yeah.
Which one aggravated?
To make it worse?
You limited with your range of motion.
Yeah,
You're
this
tired.
way and this way.
How much pain?
This one, you mean to increase? It would increase about 1 more, 2 more levels.
Total, how much?
So, let me say, maybe like a 6, 7. And this one, right?
You're limited here.
Yeah.
Just remember how far you can see from left and right, okay?
Okay. Let me see. Computers. Yeah, I can't go beyond that because it'll start to hurt. Yeah. Yeah.
Did you have any head trauma, accidents, any injuries?
Not on my head.
Where?
On my neck
Where? How did you do that?
When I went to a chiropractor, when he cracked my neck, I heard a crack, and then it hurt.
It was aggressive mobilization?
Yeah, and it felt like something tore.
Wow.
Yeah.
Okay. Are you going to the same person again?
No, I stopped going. So after the tear, and then he did it one more time. So,
again?
Yeah, so he did it twice. He's like, oh, I said, oh, that hurt a lot, and then he's like, oh, let me fix it, and then he did it one more time.
Oh.
And then afterwards, he told me to go back. So I actually went back for 1 more month,
Mm-hmm.
and then I stopped because it just.
Oh my gosh! If it's here,
Yeah,
let's
to
do
me.
it again.
Yeah.
Oh, sorry about that. I'm sorry that you had bad experience. Yeah. Is that too much?
No.
Make sure everything pain-free, okay?
Okay. Okay, that's too much.
Sorry. You feel the tightness here?
Mm-hmm.
Mm-hmm. How does that feel when I'm doing? Feel all the tightness you have here?
Yeah.
Mm-hmm.
It's too much.
Sure. Mm-hmm. What about now?
Yeah.
Is it okay?
Yeah.
Okay, let's scoot forward a little bit. You can work on your back a little bit. Is that okay?
Yeah.
And the headache, where do you feel it the worst? You feel pressure behind your eyes?
No.
No. Okay.
Or actually, around here, yes.
That's it. So
Yeah.
that's a scar tissue. Did you hit your head?
Not that I remember.
You sure?
Yeah. Not that I remember.
Okay.
I mean, like,
Mhm.
if people have their elbow accidentally hit me, maybe. But not like I didn't hit an object or anything.
Yeah, you're not falling.
Or if I'm under a table and I come up and I hit it. Does that count?
Yes, that's a hit.
Okay, then probably.
Are you like? Is that usual to be under the table?
Yeah, I was a teacher, so sometimes I need to go under a table and get stuff.
Yeah, like how often we do this? Okay, let's come and line you back in here.
This like felt a little bit better. This now is like flat here. Yeah. That hurts.
Sure, sure, sure. Put your head up. Okay, relax. Let me know if you feel any pain on that. Okay, so drink some water and sit up and tell me how is the headache now. So you had it all day long today, yeah? Non-stop.
Non-stop.
Okay, let's tell me how this feels. 0 to 10.
Maybe like a 4.
Where?
Right here. That hurts.
Sure. How about now?
That's better.
Mm-hmm.
That's good.
Too much or it's okay?
It's okay.
Okay. Drink some more water and really drink water, you know. Okay, how's that feel?
It's much better.
0 to 10?
Maybe like 2. 1 or 2.
Okay. How's your neck? Let's move your neck. You still feel the pain or it's gone?
More degree.
You move
I see it.
I can move a little bit. Yeah, I can see a little bit past the computer.
Mm-hmm.
This one is very tight.
Okay.
This one is better too.
Mm-hmm. Okay, more water. Okay, move around and tell me how that feels. The headache from 0 to 10 and the neck pain.
Headache is 1
Where?
right here.
And the neck.
It's heavy here.
Mm-hmm.
Here. Heavy. Just feel heavy.
And here? Look up nice and tall. No, I actually need, what can I use? Look up nice and tall. Let's move your hair to the side. So if I get like some lotion in your hair,
Oh, no problem.
don't blame it on me after that, okay?
Okay.
It's washable, that's okay. It's just gonna take you a couple of weeks and then everything will be back to normal. Not really, just go wash. You'll be fine.
Okay.
You will laugh, okay? Too much?
It's okay.
Okay, let's move your neck and tell me how it's got feel. What's that? We're going further, yeah? Extend, flex. What's
What
that?
more? Good. Good.
It's more.
I see it.
You feel any tightness?
Just here.
Good. Okay. Is that just in that spot or other spot too?
The neck area is much better. Now it's here.
Well, we did not work on this.
Yeah.
So what about the headache? Is it the headache is gone?
Headache is just a little bit right.
Right in here. Mhm. Okay, try it again. Let's drink some water. Let's finish the water here. Can you filter more water? Thank you. Okay. Headache and neck pain.
Neck is much better.
Headache.
Headache. It's on the left now.
How much from 0 to 10?
This one is probably a 2.
Where? Okay, do it again. Headache and the neck.
Better.
Yeah, it's good.
Gone.
It's gone.
Beautiful. Alright, so feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.